Hi, this is a quick primer on social marketing to give you a little bit of basic information for our discussion this week in class. I want to start by talking first about the difference between the health behaviors we intend to do and what we actually do. I'm sure if any of you think back over the weekend, there was probably something health related that you either intended to do, like eating healthier or getting more sleep or exercising more, or something that you had hoped not to do, like you were going to really try to watch your snacking, or you were going to try to eat a lower fat diet. Something like that that you maybe intended but didn't quite get done. And the thing is, there's a big difference between the things that we know we should do and what we actually do. It's very difficult sometimes when our intentions come up against reality, and particularly when it comes to a lot of health habits, but also detection and screening behaviors and safe behaviors that we know we should be taking part in. And we just simply don't get around to it sometimes. Maybe our motivation isn't quite as strong as it needs to be to make us do the healthy thing. Well, nobody knows more about motivating people to do things by really understanding their needs and desires than corporate America and corporate marketers, the folks on Madison Avenue. They do a fantastic job of persuading us to do all kinds of things, like paying a lot of money for tennis shoes or blue jeans or eating unhealthy foods. They motivate us by showing us, or at least giving us the perception, that these things are meeting our needs in some way. And this is really the basis from which social marketing starts, is that if we understand what people's needs and desires are and show them a way that a behavior perhaps can meet those needs and desires, then they're going to be more likely to do it. So social marketers borrow a page from corporate marketing, but they do it not to make money, but for the social good. Social marketing fits in also with a particular group of people. I think we talked about this in class, but there are some people out there who simply knowing what is healthy and correct and advised is enough for them. There's like a continuum of people, and you've got those people who just knowing they should eat a low-fat diet with plenty of fruits and vegetables is enough for them. They go ahead and do it. Those are the people for whom awareness is enough. There are other people on the other end of the spectrum who, no matter what you do, are not going to follow the rules unless they're actually forced to do it. They have to be coerced into it, often with a law or a mandate of some kind. But in between are the rest of us, the bulk of us, and those are the people who social marketing is designed to impact. The people who will do something if we can show them that it meets their needs. Social marketing uses some key fundamentals from the marketing world. First of all, it puts the audience foremost. It thinks about the audience before it thinks of anything else, and really tries to get an idea of what the audience's values are and what its core needs are. Secondly, it segments that audience, because even when you understand the needs and desires and values of part of your audience, it's not going to be universally the same. So social marketers work to segment the audience into much smaller groups that can receive a tailored message, and they sort out the audience by demographics, by stages of change, risks and opportunities, attitudes, all kinds of things, many of the things that we'll talk about when we discuss audience analysis. Importantly, social marketing also uses something from the marketing world called the 4 Ps: product, price, place, and promotion. We're going to talk in a minute about some examples of what these things are, but essentially product is what we're selling people. And in public health, we're selling people on a behavior. The price is what it will cost people to do that behavior. Cost, of course, can be in terms of dollars, But quite often when we're talking about a health behavior, we're talking about other kinds of costs, hassle, embarrassment, inconvenience, anxiety. Those kinds of things may be part of the price for a healthy behavior. There is also the idea of place, that it is important where we make a product available for people, that the place has a lot to do with motivating people to actually buy the product or be sold on the behavior. And finally, promotion. That's the part that most of us are most familiar with, which is the message, the advertising, the public relations, the stuff that's out there that really captures people's attention. So what does this look like when we look at, say, a corporate marketing example versus a public health example? Let's take a corporate entity that we're all familiar with, Starbucks, and think about what is their product. Well, obviously it's coffee. But of course it's not just any coffee, because you could get coffee at a lot of different places. So what is the actual product that they're selling? I mean, what are they really getting people to buy that is reaching people's values or targeting these specific audience groups? Well, in social marketing, we call that the core product. So there's an actual product, it's coffee, but the core product, depending on the audience segment, might be coffee as a status symbol, it might be the ambiance of a Starbucks location, it might be the indulgence factor, and it might be a lot of other different things. There are many, many segments of the Starbucks audience or group of customers. So we're selling this product to people. What's the price? In the case of Starbucks, it might be as much as like $4 for a cup of coffee. It's quite a bit more than people would pay if they walked into a 7-Eleven or into Dunkin' Donuts to get a cup of coffee. So Starbucks is betting that its core product, these things that we've listed here plus more, are going to be worth that price to the customer that they're trying to target. And that's a key thing. There's an exchange that happens in social marketing and in corporate marketing. The core product, must be worth the price that people pay. Finally, place. Of course, Starbucks is sold in a lot of different locations, and each of those is different. Each of those is very consistent in many ways, and so place has become an important part of their strategy. And then promotion. There are many kinds of things out there promoting Starbucks, many ways in which they reach their customers. And again, it depends on the segment of customer that they're trying to reach. So how does it look if we talk about a product in the public health world? Another recognizable symbol you see here, the pink ribbon, as recognizable as the Starbucks mermaid, I think. And what is the actual product? Well, of course, the pink ribbon represents a lot to do with breast cancer, but let's say our specific product that we're talking about now is a mammogram. So the mammogram is the actual product, but what is the core product? The core product, again, depending on the particular audience segment that you're trying to reach, might be something like peace of mind. It might be longevity as a caretaker, being around to take care of your children and grandchildren when they grow up. Empowerment, the idea of knowing what your breast cancer status is, not being uncertain anymore. Those are some of the things. There might be others. What's the price? Well, when we talk about health behavior like this, something that a screening behavior that we want people to do, of course there is a price associated with it. If somebody's uninsured, it might be quite costly. Even if they're insured, they might have a copay. But when we talk about price, it's not just the money, it's other stuff. So for a mammogram, it might be inconvenience, anxiety, discomfort, those kinds of things. And so we want to be sure that the core product that we're offering people is worth that price. We want to show them that it's worth the price. Place, when it comes to mammograms, place has been very important, because not only can you get one in a hospital, but mobile units have become a big part of the outreach, because they really help overcome some of the problems like inconvenience that maybe keep people from getting a regular mammogram. And finally, promotion. Just like with Starbucks, there are all kinds of promotions that have been used to get people out there and engaging in this behavior. So we could go on and on with a list of those. But hopefully that gives you an idea of what the 4Ps are and what they look like when we're talking about corporate marketing versus social marketing. A couple other things I want to note: that social marketing is always behavioral in nature. You may have some objectives thrown in that are informational, but ultimately the major goals and objectives of a social marketing campaign are going to be about behavior change. As I mentioned before, social marketing is very much about exchange. It's about the core product being worth the price. It's also about the behavior meeting the need. And in fact, showing people that that maybe the dysfunctional thing that they used to do that met some need for them can be met in a much more functional, healthy way. And we'll talk a little bit more about that in class. Social marketing also uses multiple channels and approaches, just like any other campaign. It may target multiple audience streams, so it's not just focused necessarily on the consumer or public level, but it also may target policymakers and intermediaries. We refer to these different groups as downstream, i.e. the consumer level, midstream, and upstream. And social marketing also, of course, builds in measurable objectives for evaluation. That's a key part of a social marketing campaign, as it should be for any communication campaign. So that's a little bit about social marketing. Be sure to know what the 4Ps are, because we're going to be talking about those and using those in an exercise in class. See you in class. Bye-bye.